Hello, good evening, friends. Dr. Chetna here again. Today we are going to talk on heart disease in pregnancy. Now, heart disease is not that common in pregnancy these days. Earlier in India, because of the rheumatic fever, because of the sore throat, a lot of women will get bacterial heart disease, which affected their walls, and it could lead to various problems during pregnancy. However, these days, that particular thing is not common, and rheumatic heart disease is not seen very often, which used to be seen about 25 years back. So now, why we should get heart disease? Heart disease is typically a disease of older women. It is less commonly seen in younger women unless it is a congenital heart disease. So we can divide the heart disease into congenital heart disease, that is by birth heart disease, or acquired heart disease, which occurs over time. So congenital heart disease is the one where you have a defective heart from birth. Now, if the it is a very minor thing like a small ASD or small VSD, typically most of them they get healed by the time you grow up, and by your reproductive age you're not aware. But a lot of them they escape detection and they first manifest during pregnancy. And why it happens? It happens because during pregnancy there's expansion of the plasma volume by about 50%, and there is an expansion of red cells also. The heart is pumping about 20% more, and the blood output also increases by almost 30 to 40%. So there's a significant load on the heart. And this cardiac load, if the heart is not normal, is not taken well by the pregnancy, and it starts failing. And that will become apparent in early or advanced stages of pregnancy, and it gets precipitated during labor or post delivery. So it is very important to have a cardiac evaluation of every woman when she's pregnant to know that she has no cardiac disease and she's able to carry a pregnancy full term without fail. So this is the by birth heart disease. Then there are acquired heart disease, which is typically a coronary artery disease. Now this happens in older women. As we grow old, we have more chances of developing a heart disease because of the atherosclerosis or the cholesterol blocking the veins or the blood supply to the heart, and also because of the calcium deposit in the blood vessels of the heart. So it is important that you need to know what is your coronary risk status. It also depends if you're a smoker, if you're an elderly woman who has conceived, or if you have a family history of a strong family history of heart disease or coronary artery disease, high cholesterol, you are obese, or you don't exercise, or you have unhealthy lifestyle. So these could be the reasons that you could be having coronary artery disease. And the chances of having such a disease in India is very rare. It's about 1 in 35,000. There's another disease which is very deadly and serious, is known as cardiomyopathy. Now, the causes of cardiomyopathy is not known. It could be viral, it could be other reasons. A lot of times it is considered to be some active metabolite of prolactin hormone. So the cause is not clearly known to science, but whenever it occurs, that is very risky to the woman. It can occur anytime, but more so after delivery. Women who have history of high blood pressure, history of clots, who are on thrombolytic therapies, who have replace their cardiac walls, you had disease by birth. So these women are more prone to have problems during pregnancy. Now, when it comes to transmission of cardiac disease to the child, they have about five, if the parents are affected, there's a 5% chance that the baby could be affected. Then, women who are taking anti-epileptic drugs or treatment for depression, anxiety, these women can have also increased chances of giving birth to babies with cardiac defects. If you have already given birth to a baby with cardiac defect, the chances of that repeating is about 5%. So altogether, every single child should be evaluated for a cardiac defect, and also the mother. But today we are especially talking about cardiac disease in the mother. The implications on the pregnancy is genetic transmission if it is a genetic disease. But if the woman has got acquired cardiac disease, it doesn't get transmitted to the baby. So now, if the woman is pregnant, how she evaluates that the heart is good? First, we have to take a history taking. What's her age? What's her weight? What's her exercise status? Whether she smokes or no, she is vegetarian. what kind of foods she consumes, and what is her pulse rate, any ECG problems or any other issues in the past. Are there any comorbidities like diabetes? So all these to be evaluated. Thereafter, if it required, we can do some exercise tolerance to know whether she's doing well or no. An ECG can be taken, which is a very basic screening test, and a major disease can be missed on that. If required, we do an echo. If echo is normal, there's a very small chance of anything wrong there, and majority of the women will not have any problems if all the tests are normal and they continue with their pregnancy. Now, there are certain conditions where the woman should not be conceiving. So these conditions you may not be aware, but I can tell a few names like Marfan syndrome. If you have a severe wall disease, if there is a pulmonary hypertension, if there is a history of cardiomyopathy in the past, and in such a situation, if you think there is a pregnancy, you confirm it, and then you have to have a joint discussion with a gynecologist, your fetal medicine specialist, and with your cardiologist to know whether you can continue with the pregnancy. Because continuing with the pregnancy may cause so much severe load on the heart that the death rate amongst the women with pulmonary hypertension is as high as 50%. So it is not recommended to continue with the pregnancy, and these women should discontinue with their pregnancy as soon as they come to know. Rather, they should be very careful in preventing a pregnancy, and they have to identify other means to have babies. The rest of the women, they should get evaluated if their ejection fraction is good, their ECG is good, their echo is good, everything is fine, they are not breathless, they can climb steps, then there should not be any problem and they should be able to carry forward a pregnancy. So anytime if you think that you have chest pain, pain radiating to arm, going to jaw, you have thumping in the chest, you sweat after walking, or you sweat too much sweat unnecessarily, if you think heaviness, constriction in the chest, please report to the doctor, because over time we are likely to see more cases of coronary artery disease or the heart disease in pregnancy. Coronary artery disease is kind of beginning of heart attack, you can say. It is like once it starts and gradually over time when the blood stops to the heart, it converts into a heart attack, which could be minor or major. So it is extremely important for you to know what is your cardiac status, and if you are young, then probably it's fine. But otherwise, if you're over 35, you should have a cardiac evaluation done when and before you plan a pregnancy. So thank you so much for your patient listening. And if any questions, you're welcome. I would also like to reiterate here that some women will actually need low molecular weight heparin to prevent a cardiac event. And these are the women who have high platelet counts, who are hypertensive, we have history of thrombotic events in the past. So there's a question here. Uh, what causes heart problems during pregnancy? During pregnancy, there is no increase in chance of heart problem. It is your pre-existing condition which gets precipitated during pregnancy. So it could be by birth or it could be acquired. And the factors of acquired heart disease are, as I told you, obesity, late childbirth, family history, smoking, poor lifestyle, no exercise, fatty food, and genetic tendency, certainly. So all this can lead to the problems, that is coronary artery disease during pregnancy. Congenital heart disease is by birth. If you have it, you have it. Otherwise, you don't have it. The other question is, which heart condition is not a contraindication of pregnancy? So other than what I spoke, majority of the heart conditions you're safe if you have small ASD, small VSD. If so, basically, it's not the disease per se. There are certain diseases that are very severe, and in those scenarios, you can't carry forward the pregnancy. But in majority of the other cases, if your cardiac function is near normal or normal, and you have exercise tolerance is good, then you can proceed with the pregnancy. And if you are really strong and your cardiologist allows, you can have a normal delivery. If the cardiologist will suggest, we can cut short the second stage of labor by pulling the baby out. But majority of the women should be able to have a safe vaginal delivery or a cesarean section. So you can do a cardiac evaluation. And if it is good, then you don't have to worry about what is your cardiac condition. But you must have adequate cardiac output and ventricular function, ejection fraction is good, and your oxygen saturation remains good. your pulse remains around 100 and not more, and you should be fine. I'm 28 and have diabetes and also a little heart condition. I want to plan for a pregnancy. Which kind of heart condition? So I suggest that you speak to either, I think the better advice would be to a cardiologist, because your diabetes can be solved by the gynae itself. So you can just have a consult with a gynae and a cardiologist. So cardiologist will just do one consult and get you going that what all precautions you will take during pregnancy and before that. And there are certain medications, if you are on that can be shifted to simpler medications so that they are fetal safe and you can continue the pregnancy. You are very young, and diabetes and a cardiac disease together, it's not that deadly that you cannot have anything, but certainly a good control will help and will help you in achieving a healthy baby, healthy pregnancy, a normal sized baby, and a normal delivery. My wife had a medical history, but now she's fine. Will this affect the child can also get heart disease? So the medical history of heart disease. So now again, if it is a congenital heart disease, there is a chance that the baby can have it, about 5% chance. But if it was not a congenital or a hereditary disease, then it's very unlikely that the baby is affected. So this condition is typically the rheumatic heart disease. So it happens through sore throat. When we have sore throat, we not attended to these bacteria. They travel from the blood circulation and go onto the heart. And then they sit on the heart walls and they damage it. So such a case is known as rheumatic heart disease. So rheumatic heart disease is not genetic and not transmissible to the baby, but if there is a congenital heart disease, that is by birth heart disease, then it can be transmitted to the baby. The chances of about 5%. Which heart disease is tolerable during pregnancy? So there are only 3, 4 conditions where you cannot plan a pregnancy, like Marfan's, like pulmonary hypertension. There are severe cardiac conditions in which the cardiac output is less than 1/3. But otherwise, if your cardiac function is good, your ECG is normal, you can in fact do a treadmill test if required, a CT angio. If all this is normal, then there should not be any problem. So you should consult a cardiologist, do an echocardiogram, and you will be advised whether you need anything else or you're fine and you can get forward. So please get your echocardiography done, and if that is fine, just don't worry and carry forward the pregnancy. And obviously, you will have to stick to the exercise plan which the doctor will prescribe. That you have to take only this much amount of exercise, you cannot take or more or less. So all that, and also you have to control your weight, you have to control your diet, salt, fat intake, sugar intake, sleeping on time. All this will help in achieving a very healthy pregnancy. So majority of women with heart disease are able to produce a healthy baby, but certainly it cannot come at the cost of the woman, and it is extremely important to have cardiac evaluation from the cardiologist to know whether they are fit to carry a baby. Is it safe to get pregnant with a heart condition? Yes, majority of the times it is safe to get pregnant, but there are certain contraindications in which situation you should never be conceiving. And if these conditions are present, please terminate your pregnancy after talking to the cardiologist, who will suggest whether it is safe to have pregnancy with your disease or you need to terminate. Thank you so much. Thank you for your patient listening. We'll be back next Wednesday with new topic. Till then, stay tuned. Thank you. Bye bye.